What can we do if we are having significant allergy symptoms to pollen?
Well, the first thing I want to do is tell the public about over-the-counter remedies. We might not have to go see our medical provider. There are a lot of over-the-counter remedies that are out there that work very, very well. Some of these include your antihistamines, such as your Zyrtec, your Allegra, your Claritin. They work pretty well. Then you can also do your nasal spray, like Flonase, this steroid nasal inhaler. It really is. It helps a lot with those allergies because that pollen, I mean, it's everywhere. It's on our cars, it's everywhere, and it can make you feel really miserable. So first, I try those over-the-counter remedies, and if that doesn't work, then I consider going to see my medical provider.
So when do you recommend that, Dr. Quinn? I know you just said it if those remedies, over-the-counter remedies, don't work, to visit the doctor, but what are some of the prescription treatments that you recommend then?
Well, I had a really interesting conversation with one of my colleagues. He's one of the heads at UMC at the Ear, Nose, and Throat Clinic. And basically, he shared his magic bullet remedy. And that includes maybe using two nasal inhalers. One is a steroid. It's like your Flonase. You do two puffs, puff, 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 puff. And then the second is Astolin. It's an antihistamine nasal spray. You can do two sprays with that as well, like spray, 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 spray. And with the steroid nasal spray and the antihistamine nasal spray together, it works really, really well. And then you would also do your typical antihistamine, such as your Zyrtec, your Claritin, Allegra. But then you can add something called a mucotrain inhibitor, such as your Singulair. And the combination of those four, he calls it his magic bullet, and he's gotten a lot of success for a lot of his patients.
Good, that's what we like to hear. Well, some people may have this question, but how do they determine if it's allergies, Dr. Quinn, versus an upper respiratory tract infection?
Right. Now, that's something that we really want to pay attention to. Let's hypothetically say we have fever, a productive cough. Then there's a higher probability that you could have an infection with either a virus or even a bacteria. That's when you especially need to visit your medical provider. And then in that case, they might provide some type of antibiotics or even an antiviral. We'd also test to make sure you don't have the flu or coronavirus, which is a possibility as well. But the take home is right now, while the pollen is out, the flowers are growing. I mean, you can see behind me, it's very beautiful outside, but the allergies can make people quite miserable, but there are treatment options out there.